Finally, that grim milestone. More than 100,000 Americans have now died of coronavirus. It's an enormous number, and the value of those lives is immeasurable. On a single day in 2001, America lost just under 3,000 people aboard the 4 hijacked planes and the attacks on the World Trade Center and Pentagon. That earth-shaking day spawned the 19-year-long war in Afghanistan. 2,300 Americans died on that battlefield. Another 4,400 U.S. troops were lost in the fight for Iraq. Those figures don't capture the horror or the extent of our grief, nor the impact on the rest of the world. Yet that's a fraction of the more than 103,000 lives claimed by the coronavirus on U.S. soil in the past 3 months. Each day, nearly 1,000 Americans die from it. The attack on Pearl Harbor killed 2,400 Americans in less than 24 hours, launching a generation of Americans into the Second World War. It would take 43 Pearl Harbors to equal all of those lost to COVID-19. But how does one write more than 100,000 obituaries? If these numbers seem unfathomable, consider them another way. That's the size of the entire population of South Bend, Indiana. And how do we continue to say that we're all in this together when the numbers show that we're not sharing the burden equally? Black Americans have a COVID-19 mortality rate nearly 2.5 times that of white Americans. Hispanics are hospitalized at a rate approximately 3.5 times that of whites. Those figures reveal the tragic consequence of income inequality, healthcare access, but also the fact that people of color make up the majority of frontline workers who we all rely on in this fight. The grocery workers, the police, the healthcare aides. We've all been warned to brace for more loss. The White House projects the death toll may climb to 240,000 Americans. Roughly 4 times as many dead as the number of names inscribed on the black granite of the Vietnam Memorial. The lives already lost outnumber the fallen from the wars in Vietnam, Korea, Afghanistan, and Iraq combined. The glimmer of hope that remains is the fact that the majority of those who get the virus do recover. But for those who do not, the loss is incalculable.